Judy Kaye credits the University of Louisville School of Nursing for saving her life. She was in her final semester before graduation as a nursing student when she was diagnosed with a rare form of cancer and told she had just 18 months to live. Determined to graduate from U of L and walk across the stage, she credits the help of her professors and fellow nursing students with not only helping her to graduate, but leading her to a successful career in nursing. Her advice to nursing students: get all the education you can and never quit learning and helping others, for nursing is the helping profession that changes and saves lives. Introducing this year's School of Nursing Fellow, Judy Kaye.
I started out, and I don't know if you can see that little house right there. It's a 2-room little tiny house on a dirt road south of Fairdale. That's where I began, and that actually, I'm sitting in front of that house. I was a year old, and we were very poor, but we didn't know it. And I was blessed to be able to go to college. I was able to get a scholarship for my associate degree, and then I worked full-time and raised my 2 daughters and also went to school part-time. And I just did not give up. I just kept going, and I was determined to get all the education that I could, because I felt that was my way out of poverty, and also to help people. So that's why I've always had the heart to want to help, people that perhaps couldn't afford to go to college. And I ended up at my master's at U of L doing my master's degree in nursing, because it was a wonderful, wonderful nursing program. And of course, I love, University of Louisville. I live there and love the area. Wanted to do research on spirituality and how people use it to cope because I worked a lot in a critical care unit, and I saw that played out in so many of my patients and their families. And I felt like it really was an important aspect of coping with illnesses that had not had any research. So Dr. Robinson set me up at the emergency room at the university as the clinical chaplain for one of my rotations. And that really helped me to formulate and write my thesis on that. And I did go ahead and do that in my doctoral studies, and actually my dissertation as well as my thesis were both on spirituality as a coping mechanism. I think it was actually listening and actually hearing what the people were saying, and helping them to find ways to cope or to help them with what they were experiencing. I did go on to teach nursing for a number of years, so I think that after I finished my PhD, I did teach for a number of years. I worked in the trauma units and the burn units. The burn unit was the hardest for me to work in. And the bone marrow transplant, I took care of some fairly young teenage people. So, having the heart to want to help them, I was so glad to be able to be there with them and their families. But at the same time, it was sometimes hard to lose them and to see them suffer. But I was so thankful that I could be there at those very difficult times and have the skills to help them with my nursing skills, as well as, with the coping skills. I also have tried to establish the Judy Kaye scholarship that is for someone that can't afford to go. And so I am working on establishing that scholarship. If someone had not given me scholarships and I had not been able to get funding, I would not have been able to go to school. So I want to help someone else. And that was like myself, that was from a really poor area. And we didn't know we were poor at all. But I used to, my little dresses that I had when I was a little kid was made out of the feed sacks that the cow's food came in. So I want to help somebody else that has the heart to want to go forward and make a difference in the world and give to other people and help other people. And I think nursing is the most wonderful opportunity that there is in order to do that. So I cannot say how thankful I am to have had the experience of going to University of Louisville to get my master's and to be a nurse. I just can't thank the people at University of Louisville enough for having had the opportunity to go there and for reaching out and staying in touch with me.